Hey y'all, welcome back to Super Experiment Day 3. Okay. We're doing 10 days, 25 minutes, putting 25 minutes on the clock because I want to help my friend Michael here because Michael has had pain for over a year. This is Michael. And we have treated him twice, and now we're going to do Day 3. Today we're going to accomplish a few things. We need to recheck our exercises. We need to do a bunch of body work. The body work's going to focus on the back side today, but let's recheck those exercises. Let's see these extension ones. Go ahead and bend your knees, sit up. If you remember these exercises, I only have 25 minutes with Michael, so I've given him some home exercises to work on himself. Not bad, man. Looks good. Good control. Yeah. Does it feel pretty easy up here? Yeah, it feels pretty. Yeah, so I want him to be able to extend back slowly. He's doing really good. That's awesome. Does it feel easier than day one? Harder than day one? Easier. Okay, great. Relax back. Let's check the second exercise. Core, dead bug, Texas armadillo, hands behind your neck. I know. Good. Come on, try. Michael actually already did some running this morning. Let's lift up. Nice. Take a deep breath. There you go. One of the things that, good job. One of the reasons we need a core is because this needs to stay tight and this needs to expand as he breathes. Super important. Okay, so you had some twitching in the neck. How are your symptoms? What were you experiencing between Day 2 and Day 3?
I felt like my body was unwinding.
Okay, we'll take that.
Yeah. So when I say twitching, it was like my body was like twisting and twitching, like it was unwinding, like it was releasing almost.
Fantastic. Let's do more releasing. The idea is, since Michael has pain for over a year, that means it's chronic, that means there are it's multifactorial. So we're trying to do a bunch of different things. Today I hope to get 5 or 6 things done. We'll go back and check those exercises. Oh, I was gonna do one other thing today. I'll grab it, we'll do it kind of in the second half of the video. I thought of a new exercise. I'm gonna watch the clock, so at 12 minutes, in 10 minutes I'm gonna go grab a new thing, we'll do a new exercise. But what I want you to do is to go face down because I'm gonna do some manual therapy work to, hold on, let me get you this face thing, my guy. You want to cover for that? Yeah, I do. Dude, I'm going. I know the time is running, but you know what?
Safety first.
Safety first. Put your face there. Now, hold on. There's one more thing I'm going to need from you, actually. I'm going to take this towel. I'm going to twist your life. You already know what's coming. Can we go all the way with it? Let's go all the way with it. Let's put it on right there, and then lay down there. Okay. So I'm trying to turn his torso this way, and then we'll do it basically on the other side as well. Okay. So let's try that. Take 3 feet. 3 minutes. I'm weary of the time, but also we have 10 days, so it's not going crazy. Okay. So this side is puffed up. One way to examine this is to have him take a big deep breath in. And then as he breathes out, can the spine rotate down this way? It can. Breathe in. And breathe out. We're gonna make sure it rotates all the way this way. Let's see if we can get right on top of that. Good. Breathe in. Breathe out. So this whole technique I learned from this old Australian guy is you would go segment by segment. Does that one move that way? Good, it does. Does that one move that way? Yes, it does. Breathe in. This is where it gets a little stickier up here. So actually then breathe in. Let's see if we can go the other way. And exhale. Oh, we don't like that, do we? You can see the kind of reactions there, right? Breathe in. And all the way out. So this also will release old Che towel And my European doctor friends will probably understand those a little bit better in terms of freeing up the transitional zones, i.e. from his lumbar spine to his hips, lumbar spine to thoracic, so this transitional zone, and then up here at the neck as well. So since your right side is opened, let's go right side. We're just gonna get all along this spine, free up the spine. So one of the things about movement that I've been meaning to talk about today, forever and always, is the fact that movement is predictive. In other words, like your brain is essentially constantly predicting. Actually, it's not going to be how fast it's listening on top of this thing. So we're working right along the spine. A lot of friends in the bodywork world will talk about the spinal reflexes, i.e. your nerves are in your spine, so it comes out of your spine. So if those nerves do not have the appropriate feedback that they need, because the muscles are tense, the soft tissues are tense, they're reactive, the reaction of the body is that of protection rather than posture, and that's what we're seeing here with Michael, is that his reaction is protection, and there's nothing wrong with that. Please protect yourself in life, right? I also like to add a little tension, so we'll go here, and then basically open up the spine, which allows his body to sense more, so it can perceive more, so it can react more appropriately outside of its old protective patterns. That's basically the trick of bodywork. That's a good one.
Felt that in my head.
Felt? If you can't hear that, Michael's face is buried in the thing. It says he felt that in his head. Mumble Mike, we call him now. Hey, it's me, Chris and Mike. Remember? Where's my other screen? Just wasting time, you know? One of my favorite books, people often ask these questions. Serge Grekovetski has a book called The Spinal Engine. I haven't read it in years. I probably should get back to it. See all those protective reactions that he's having there with his arm? Totally natural. Body's just trying to protect itself. But chill, you know? So what I'm doing is a little pin and stretch. We're pinning these muscles and then kind of pulling the soft tissue into left rotation. Now we can do the same thing and pull right, which also you can feel a good amount of resistance. And you're just kind of feeling for the resistance. So the ribs kind of go down this direction. Dude. Yeah, he is all tied up. If I could accomplish one thing today, and that was to free up his spine, I think that would be a good day 3. You know what I mean?
Let's do it.
Let's do a spinal focus, and that's one of the reasons where, come on, where are my tools? Where are your tools when you need them? It's gonna hit, oh, there she is. Yeah. All right, we gotta bring in the big boys. This guy. Okay, now we're working. Yeah, here's the thumbs up. So it's freeing up nicely into this left rotation. Like you can see, it's getting far more pliable that way. Except when we get further up. But what about when we go in this direction? A bit more clunky. Position wise, let's go over here. So it's literally the same area, gosh. Same area, we're just trying to make sure the soft tissue goes that way and this way. There we go. Friend Alex is coming in later today.
Who's that?
It's our friend who comes to the gym. And then her life gets busy.
We love Alex.
We love Alex so much.
So much.
Good. That was a good release for that one. Okay. Protective guy. Let's see if we can't keep this up. I am bad with you. Bad with my left hand, but gosh, you need that. That is getting red almost immediately. The little red spots, the scientific word for them is petechiae. Petechiae? Someone in the comments will correct me. The other day I was talking about supination and pronation. Got corrected in the comments. Thank you for commenting.
It's a good time to hit the notification bell.
If this video gets 10,000 likes, smash the like button. Subscribe. Does the notification bell even work? Like, does that... Have you ever hit the notification bell?
Can't confirm.
It does?
Can't confirm.
Okay, hit the notification bell, guys. That's just what you gotta do now. Yeah. 12 minutes in. Wow, halfway home. Let's go to the exercise. I still gotta get the left side. Sit up 1 second and move around. Tell the people how you're feeling real quick. I'm gonna be back in like 60 seconds.
Feel a lot looser. Right side of my neck.
It's weird talking to a camera, right?
I said like one thing and then just turned around.
I know, it's fair. I didn't think you would say much. Okay, let's do some side lying. Let's have you lay with your left side down, right side up first, okay? Look what I got, guys. It's called a kettlebell. Now, this kettlebell size is a little bit deceiving, okay? It's a big boy. My hands are all greasy, so what we're gonna do you already know?
No, but I have an idea.
You do. Let's keep your top leg bent. That. Arms straight up to the sky. Okay. So this is meant to direct and change the shoulder blade. So this is 15 pounds, but this is like not very much. So what you're going to do is make sure you draw this shoulder down. And you're going to stay on a rope here, but then slowly rotate the bell here. And slowly rotate the bell there. Try to get a little bit, your wrist is backwards like this. Kettlebell people would be furious. There we are. Sorry, kettlebell people. I fixed it.
I'm not sorry, kettlebell people.
There we go. Okay. So, we're just slowly, this is called an arm bar. The muscles of the rotator cuff are not prime movers, and they help switch between the prime movers, you okay?
Yep.
Good.
Say bye to my sister.
Bye, sister.
Bye, Liv. Love you.
Love you.
So the rotator cuff muscles are small muscles. They work because they fire fast, okay? They're fast twitch action. So when these muscles go back and forth, it's not training your big one. You're not gonna get jacked by this. But you'll see the transition between them. There are these little hitches in your gidea. You noticing that?
Yeah.
Little twitches. So this is proper rotate. The other thing would be to squeeze this as hard as you can. That's also going to be a great rotator cuff. So now that you're feeling good about that, hold it here. And what you're going to do is do a little press, like bend your elbow. And as you bend, you're going to rotate this way. Then as you go up, you're gonna come forward like that. Does that make sense? Let that elbow fall back. Good. Hold on. There you go. The goal would be to get his elbow all the way down to, that's it, and go up. So this hip is staying forward down here. Hold it there, take a big deep breath. There you go. So this is a pec stretch. And then you're gonna start to feel the muscles in the back right, the area that we just worked on, right? Back of the shoulder. Yeah. Just say, ooh, a little pop in the back, that one's free. What are you feeling here, friend?
Lats.
Lats. Good.
Right here.
Okay. Lats or serratus.
Or
again,
serratus.
Or serratus. We're doing serratus again. So the serratus is going to help keep those ribs down. The serratus go here. They're kind of the opposite of these upper traps. Okay, now that you got this, let's do this on the left because that's where you really need it. So start with the arm, top leg forward. That's it. Get a little, grab it in the corner almost. That's it. See how light it is? It's 15 pounds. It's not a problem. Okay. Then you can kind of see from this angle. Okay. Good. Let's do this kind of, that's it. Good. And then roll. Yeah. Arm bar. And so this is where you're going to see a good amount of the wobblies. This is working on shoulder stability. So what happens is, if he doesn't have shoulder stability, he creates stability elsewhere, like in his neck, down here, and in the front of the shoulder. This is restoring kind of the natural harmony of the shoulder, creating shoulder stability in the shoulder itself. The shoulder complex should all work together, but it needs to kind of start here. How is it different than the other side? What are you noticing?
It's tighter.
Tighter?
Yeah.
Where do you feel that tightness? Anywhere particular?
Neck.
Neck? Yeah. One other thing kettlebell people would say all the time is to be looking up at the bell. So rotate your head. Yeah. Okay. Does that change anything? Make it less neck or more neck?
Less. I mean, it's gotten less tense as I've continued to do this.
Gotcha. And so this would be really good to do on your own time, sir. Let's do a little press and see what that does for us. So as you go back, you're going to roll this way. Let that elbow fall, and then as you go up, rolling in just a bit. Good. Let it roll down. Hips are more stable on this side. Maybe not. You're also going to want to try to keep that forearm straight up and down. He can kind of cheat with it right now because it's only 15 pounds, but it is what it is. Breathe on that. Hold it down here. Keep it down here. Big deep breath. Good. Where are you feeling this as you breathe? It's 15 pounds. He's got it. Michael's a strong guy.
Serratus.
Yes. So this is one of the commonly classic weak muscles, the serratus. Go back up. Let me tell you one more secret about the serratus. The serratus starts underneath the shoulder blades. It actually goes up into the T1 and C7. So there's fibers here that grab onto your first rib, and then they kind of start under here and come back. So they go underneath your shoulder blade and pull your shoulder blade that way. Not necessarily down and back, almost like this forward kind of swooping motion. That is why we want the serratus. We'll check back in with that. Go face down. We're going to put this onto the left side. You know the game. All right. Lift the feet up. Put the feet down. 18-minute, dude. We are crushing today. Take a big deep breath. Breathe out. Nice. Breathe in. Breathe out. Soft tissue of his back is going to love you, sir. Already moving a lot better. Alright, let's get in here. How you doing? Okay? Updates, concerns, what other people need to know? Hit the notification bell. If people comment for the algorithm, let it play again.
Be sure to subscribe.
Be sure to subscribe. Look, we said if we hit 1 million subscribers that Michael would streak naked, and I am sorry for that. So maybe actually don't subscribe. No, just kidding. This is a family channel. Yeah, love it. So that soft tissue is definitely, you can feel the tension. So like you can see his reaction is to go this way. So the way that compensation happens is position first, then the soft tissue, the muscle and connective tissue starts to stiffen to that position. And then after that, the bones and the muscle, the structure starts to conform. So unwinding it is a 3-step process. I can't change his bones and his structure. I can change the position, maybe. Subtly can change the position. But his central nervous system is going to override all day long. Sister's back from college?
Mm-hmm.
That's cool. It's summertime here in Los Angeles. It's summertime in the northern hemisphere. Dude, that's a spot, huh? Let me know if you get any of those referrals as well, like shooting up to the neck.
Serratus.
You're just gonna keep saying serratus?
What's this?
Oh, serratus.
Yeah.
Yeah.
Oh, it's like so tight. It's right here.
Okay. Gotcha. Shut up when you work.
You told me to let you know.
Shut up. Dude, we gotta keep controversy and drama with him.
That's
you know,
fair.
keep the people watching. Oh, there's a new one, pulling the shoulder down. There is a thing called a spinal reflex that you can see in babies. One of the things is they kind of run their hands up the spine essentially, and it helps, and the baby's hips will like twist left and right. And so the feedback for proper locomotion, walking, gait, ambulating. Good. There's some good scar tissue here, probably from a little growth spurt you had.
Water polo.
Water polo?
Those are toenails.
What?
Those are scars from toenails.
Wait. People's toenails?
Yeah.
In water polo?
Yeah, they'll sharpen them.
They'll sharpen their nails?
Yeah.
And they'll dig into your back? I mean, these lines are perfectly...
They'll scratch the fucking... Yeah.
What? I know nothing of sport. I'm just a silly soccer player.
Ooh, right.
Ooh, right there. Yeah. That's true. Doing all that.
It's like going away, but yeah, it's like great.
Let's show the people a good neck. Some neck work here. While we're here, these transitional zones in the neck, I'm going to pull the neck this way, and the soft tissue goes that way. Try to get this transitional zone to transition. But it's not as bad as I thought. Certainly not good. Now, ooh, that was big release. Hello. All right. Felt that?
No.
Weird. You can see the reddening of the body. Almost going directly up to the spine. Yeah. Where are you cramping? This is too juicy. Where's my... Here's the deal. If you're a body worker and you only have one type of lotion, did we talk about this or did I say this with another patient? Look, what sort of a body worker are you with only one type of lotion? Certain things work a little bit better for the tool-assisted stuff, and certain things work a little bit better with the hand stuff. Let's try this. Right on top. So what I'm going to try to do is move his shoulder blade back and forth to control that, and then I'm going to try to free up the tissue in relation to that shoulder blade. So we're pinning down the tissue in the rhomboids and then moving the tissue around the shoulder blade up and down to free the two. It's a little bit easier if you kind of put your hand, the palm of your hand on the spine of the scapula. And you can do a little bit of this rolling action. Dude, is it 25 minutes already? Holy gosh. Let's do these exercises. Call it a day. Wow. Happened way too fast. Let's do these kettlebells. Good gosh. So bad about the time. These 25-minute challenges. Where's your cup? Here. Grab this bad boy. Back shoulder, eyes up, straighter wrist if you can. But if this was heavier weight, he would have to stay straight up and down. So don't be afraid to give your patients a little bit more weight, because now he's got to learn how to stabilize in the horizontal plane. It's not the horizontal plane. They call it the frontal, or as when we rotate, that's the transverse. So now his body is learning to stabilize in a new way. So all the muscles that we just worked back here are now having to relearn in this new environment. Which is why I like to do exercise immediately after body work. Because the body will have the propensity to go back to what it did. I used to be super, what's the right word? Scared that all the body work I did would be undone. Breathe. Yeah, there you go, let it fall. Nice. That's it. Yeah, keep it back, but let your chest stay further back. I used to be really scared that all the body work I would do would be undone, and I would immediately make them do exercises, kind of like we're doing here, before they got up and interacted with the world around them. Ooh, yeah, that's good. Keep going. When you go back, turn your palm towards your face now. Yeah, like that. And that's going to get more stretch through there. Good. One more. I'll look at the other side. Breathe in. If you breathe there, you own it. If you go into a position when you're exercising and it stops your breathing, don't own the position, you're just renting it. Switch to the opposite side. Okay, so then we're now, again, re-educating the tissue, the muscle, Michael's brain. He needs re-education. Start.
God knows you're right.
God knows you're right. Lord knows.
February award. Might lose some subscribers there.
Dude, man! We're all, okay, well, all the atheists, like for Michael, agnostics, the nuns, and look, if you're a believer, absolutely comment that. Like, this is a bodywork channel. Like, this is the anatomy of therapy. Let's get into it. Prove there's no God. I dare you. Palm toward your face. Good. Look, I'm not saying that we're all creators.
But we're all content creators.
Go back up. Comment and like if you think that tech is the new God, that pleasure is the new God, that entertainment is God. That's pretty good. How does it feel on this side versus the other?
Feels way easier to get further back.
Let's do one more time on the left and then call it a day. I know.
I'm tight throughout. Ribs. Sorry.
Ribs.
Yeah, I'm tight.
You can. I mean, I don't know if the serratus. Yeah, I guess anterior serratus would kind of go that low into the ribs. Yeah. We'll just. It's close to your obliques. But really, this would be that transitional zone between the thoracic spine and the lumbar spine that I was trying to get to twist back and forth. That's one of the reasons why the hip is up at 90 degrees. If you do this and this top hip is not up at 90 degrees, meaning like parallel to kind of the belt line, because if he straightens his leg, you can straighten it. You can do it. This back has the propensity to extend, to overextend. But if the knee is up, then his back is in a more safe position. If any of you guys know the Thomas test, you know how you put one knee up and one, you know what I'm talking about. Put one knee up at 90 degrees to protect the low back. After a while, you can kind of let it go back. Yeah, there you go. With that stretch, take a deep breath or two. Keep going. Michael's going to keep doing these. Tune in next week. Like, subscribe, do all the things. If I said anything wrong, make sure we correct me. Keep going, Michael. He's going to keep doing these. Thank you all so much for watching. Have a great week.